Our community decided that rather than each and every hospital producing an individual plan representing potentially only a small share of the population, it would make a lot more sense if they did it together.
The agency saw very early on the power behind collaborating and working together versus individually. And so the county has been a partner now for the past 10 years and will continue for the next 10 years in being a major supporter of CHIP.
The wonderful part is that as everybody got together and started working, I think the spirit of CHIP infected the member organizations a good bit.
When the needs assessment process was finished, what was interesting is a high degree of trust had been developed between all these groups and a strong feeling that we ought to stay together and try to solve some of the problems that the needs assessment had been addressing.
We dared ask ourselves, can we take this to the next level? Can we stay together, work together, put away our competitive hats and mindsets, and figure out a way that we can do something to improve the health of the community?
It's always a benefit when people work together rather than competing. So it's fantastic to have hospitals and community clinics and health plans and all of the entities and organizations involved in the provision of health care at a single table.
Healthcare is constantly changing. There's never a year that goes by where a lot of things haven't changed, and CHIP is the one place where we pull all these resources together and we really know what's happening.
CHIP will continue to thrive, partly because of the people involved in CHIP. It's really wonderful to see people who are extremely busy devoting the time and energy and the commitment, and I just don't see that going away.
I got involved with CHIP in around 2011, and after the loss of my nephew Austin to suicide, I wanted to make a difference in the community, but I wasn't sure how. And so when I came, I was welcomed with open arms, both by CHIP and the Suicide Prevention Council members.
Vista Hill got involved with CHIP early on. We were one of the original core members of the community that came together to bring about the idea of CHIP. We've stayed members primarily because, truthfully, I'm scared of Kristen Garrett.
I'm really excited about CHIP's new mission. It's really about finding long-term sustainable solutions to some of our biggest health issues. So whether it's obesity or mental health or social determinants of health or access to care, these are all such big issues that we all need to tackle them together.
And this may sound kind of strange, but I've really enjoyed the fact that CHIP has also been engaged with some of the difficult things in our community that maybe for others would be a little bit too intimidating to handle, like suicide prevention and things that really matter.
One of the interesting things that I really enjoyed was after, like I said, almost 10 years with the Childhood Obesity Initiative, to hear statistically that San Diego is one of the few counties in California, probably in the United States, who actually had a reduction in the obesity rate. And I think we all felt kind of an excitement that, you know, maybe what we're doing actually had a great impact.
What impresses me about a lot of the programs is the level of collaboration. We use that word a lot, but it's collective interest and collective impact, where we work at the neighborhood level with the Resident Leadership Academy to make things happen at the grassroots neighborhood levels. That's where change occurs. That's what really excites me about what CHIP does.
I think for me the most exciting part I've had with CHIP was in 2011 when, together with the leadership of CHIP, we worked and successfully achieved a grant for suicide prevention and the suicide prevention plan for San Diego County. And even today, it's making a great impact.
One of my most favorite recent memories with CHIP has really been the community conversations through the Public Policy Committee, bringing together diverse stakeholders to talk about emerging trends in our community, hot topics.
I am a true believer in the notion of the social determinants of health. We are realizing more and more how variable things are that have an impact on people's health and well-being. And I see CHIP as a strategic entity that can continue to bring broad representation to our regional attempt at dealing with issues that we continue to struggle with.
My greatest hope for the next 20 years is that we can start to think about health in a broader context. It's really about our total well-being, including our mental health, and we need to create healthier communities. Everybody needs to have a supportive environment that they can live in so they can make healthy decisions on a daily basis. And when we achieve this, that's when we'll have true health reform.
CHIP has worked on things like getting antibiotic-free meat into our hospitals, getting farm-fresh food to preschools. These are really cutting-edge programs that I see CHIP leading on, even in the context of the rest of America. So I'm really excited to see that CHIP's not only seeing the solutions it has today, but looking for the solutions of tomorrow on these very big, intractable problems that we're all struggling with in community health.
And if you took us 20 years out, 20 more years out, you wouldn't recognize who we are, what we're doing, and this generation of new leaders will have taken over the reins. That's the future of CHIP.
The spirit of collaboration with CHIP is alive and well, whether you're the CEO, a program staff level, a volunteer, or just a community resident. If you want to participate in the solution, there is a place at the CHIP table for you. And there's not a lot of groups like that, and CHIP really has mastered diversity and collaboration.
If you are part of any of the initiatives that CHIP has put together, you know that it's going to be of high quality. You know that there's going to be a significant amount of emphasis placed on the impact, that your voice is going to be heard, that there is going to be a respected outcome with that, and that is going to have a real impact and change within the community.
If it wasn't for CHIP, who would bring us all together to solve all these community-wide problems?
Something would have to be created, like CHIP. And what the advantage we have right now is it's already created.
So if CHIP hadn't have been here, I think, for the last several decades, I really think that the idea of all of the people working together in San Diego would not be at the level they're at today. We would not see that kind of collaboration.
If it wasn't for CHIP, I would have my first Thursday of the month free.
If it wasn't for CHIP, San Diego would not be a leader in collective impact, especially in food systems across our nation.
If it wasn't for CHIP, I would not have had the pleasure to meet so many amazing people in so many great organizations in San Diego.
If it wasn't for CHIP, San Diego would be nowhere near as healthy as we are now. Our death rates would be higher from a variety of causes, both violent causes, injury-related causes, and diseases. There's no question that CHIP has had a direct impact on the health of our community.